This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch. Every Sunday, 8 till 9, Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We talk about the who, what, when, where, why, and how of Innovative Medical and how it can help you and your family improve your quality of life. And especially today, because it's duck weather today.
It is, isn't it, John?
Yeah.
It's crazy out there, man.
This is
people don't realize, right? Today's the day where, folks, you better stay in and not just listen to me. Listen to our the next hour too.
Straighten out your health and your money.
And your money. God bless. Thank you.
So anyway, if you have a challenge that you want to run by Dr. Molly, or just a simple question, 855-839-1210.
Hey, John, I want to tell you, one of my patients told me, hey, I can't seem to catch you now. You haven't been live. Last time I heard this show was Dr. Carr from Ohio, and I said, hey, 3 weeks we've been back.
That's right.
And we're on our fourth.
We didn't retire.
I said, we didn't retire, but I said, you're just not tuning in. You must be sleeping late.
Yeah, well, and they don't catch the replay.
That's right, because he's too busy worrying about who's winning tonight. Yeah. Okay, I got it.
Anyway, 855-839-1210 is the number here in the studio, 855-839-1210. So I was having a conversation this week with a friend, and he said, tell me, you go to that vitamin C thing twice a week.
Vitamin C, yes.
So he said, does that help you?
Well,
I figured I'd ask you.
How'd you answer that, John?
I said yes.
Short answer is yes.
Yes.
Okay, John, I think it's important that people know about us. And here's the thing. Everybody knows about vitamin C IV at this point. I don't think we have to go on to that in the moment. But I think it's important to tell them what Innovative is. And Innovative is actually a group of like-minded healthcare providers who can do anything that a primary care facility can do anywhere, because that's what we have. All of us work out of the primary care facility that I have here in Marlton. And so if you need a drug, if you need pharmacy, whatever, we can get it. This week I had a run on sending people out for radiology, actually. So my healthcare providers can write prescriptions for all of those things. But it's our philosophy that really separates us from another primary care facility. And our philosophy is, let's use the least amount of pharmaceutical necessary to help correct the underlying medical challenge, never putting the patient at risk, which is do no harm first, and moving a patient along to improve their quality of life.
The doctors typically, this happens, and I'm not saying anything negative about it, but what happens is you go to the doctor and you say, I have this or that. You get a pill. You get a prescription. Then you get another one. Then you get another one. And then you get another one. The next thing you know, you've got 10 pills.
Yeah.
And
some of them multiply that by 100
yes.
Problems that you might have from the side effects of the particular pharmaceuticals. The idea is, yes, when you need a pharmaceutical, you've got to take it. You know that, John. You need a prescription for hypertension. Doc will write the prescriptions for hypertension. So the question becomes, just how many prescriptions do you need? And can we take a better approach to your problem and possibly cut down, even if you need multiple prescriptions, cut down on the dosing so that you run the risk or the less of a risk for side effects?
And how many times, I know this is really hard to answer, but how many times have you helped a patient cut down on their prescriptions?
Well, I would say that we've helped more than we haven't. That's the way to answer that. We've helped more than we haven't helped. The question is, it depends on what they're coming in for, where they are in their particular condition. In other words, obviously, the earlier you get in, the better off we are to help you reduce the need for prescription meds or reduce the meds themselves. But again, you've got to understand, we're all traditionally trained. We don't believe that what we do is voodoo, which we do use hydration as the vehicle to deliver the constituents within natural products that will absolutely effectuate the change. You know, I'm a big believer in God's ingredients, and that's what my belief is, and I've seen it work.
How many treatments would a person have to get in order to effectuate change?
That's an interesting question as well, because here we go again. When do you come in? Obviously, if you're at stage 4 cancer, you're going to be seeing me. We're going steady for a little while. But if you come in with hypertension and even chronic conditions like diabetes, if you come in early enough in your diabetic challenge, even maybe when you're pre-diabetic, guess what? You can start to effectuate change in as little as 5 weeks, coming in once a week. So here we go. It depends on where you are, what the condition is, and how you really operate on the outside of my clinic. In other words, lifestyle. So these are the things we have to look at, John.
What are some of the key ingredients?
Well, you know vitamin C. Come on. That's the king of the hill, right? Vitamin C.
But I know you can't mention all of them, but
sure.
Just
amino acids like phosphatidylcholine. We also use things like glutathione, and I could go on and on in the essential amino acids and the non-essential, because they're really not non-essential to the body. And also, B vitamins. We use a tremendous amount of B vitamins. I think last week I told people I don't just have 1 or 2 B vitamins. I have a whole series of B vitamins. We also look at other vitamins E. We look at vitamin A for some conditions like skin conditions that we're seeing more and more of. So there are many things we can put in your bag. It's your bag. You come into us. You have a particular problem. I digest the problem. I look at some of the blood work. First treatment out, I give you a dose that I think is appropriate for you. Never have had a problem with it, because we go gingerly as we add on throughout your treatment protocol. So here's the deal. People tend to get well, again, depending on where they are in their continuum, they see changes in 5 weeks or so.
We often talk about side effects.
Sure.
Are there side effects with the natural products?
Sure, you can have side effects with natural products. You know how I feel. I feel when people get too much of one product, it may not be good, or too little of one product, it's not good. And also the side effects. Obviously, I need to know if you have an allergy to, let's say, tapioca. I want to know that, because then I'm not going to give you a tapioca extract of C, right? So, we ask you questions. Are you allergic to other things? We want to know. So the bottom line is, though, in 27 years, 28 in October, we have never had anyone have a serious side effect in our facility.
That's
and may thank God. And every day I get up and I thank God for that, because I know that's in His hands, but we have to be judicious as well.
That's a pretty good track record.
Yep. But we see a little low blood sugar, that. So what do we have, John? Crackers.
Right.
We have some snacks. We have some peanut butter, that kind of thing, and that really has helped.
So if you have a condition, can you figure 10 treatments and
I would say
and then
that
you're
is
finished,
exactly
or
the
what?
way. That's sometimes 10 treatments, and then you come in for a maintenance plan. That could be once a week. It could be twice a week. It could be once a month, once every 3 months. It really depends on you, the patient. I will tell you that our cancer patients are my greatest challenge, but they are also my greatest reward, because they're also very, very intelligent. They didn't just come to me out of the blue. They came to me by doing the research ahead. They know what they want, and they know how this works.
Okay, we are coming up on our first break of the morning. It is Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio. That's 855-839-1210. You have a question for Dr. Molly. You have a medical challenge you want to run by her. Feel free to call 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I return with more Health Watch after these words. We are back here on Health Watch, and as always, operators standing by at Innovative Medical Associates. And the number there, 856-489-0505. That's 856-489-0505. When you call, you want to make an appointment with Dr. Molly to sit down and go over your situation and your issues. The initial consultation is complimentary. Doesn't cost you anything, and you'll certainly learn a lot from that. 856-489-0505, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Health Watch is the show every Sunday, 8 till 9 here on Talk Radio 1210, WPHT. We're going to the phones, and we're talking to the mayor of Germantown. His name is Joe. Joe, good morning.
Hey, Joe.
Good morning,
Welcome.
Johnny. Thank you, Dr. Molly, and hello to your wonderful producer, Jim. You know, before I talk about my subject matter, I got to head out this morning to do a little food shop, but I'm going to get home in time, so I can relax and put my PJs on and watch the two AFC NFC title game.
Attaboy.
Now, of course, it would be better if the Eagles or my other, I hate to say this, I might get booed, but if my other team that got knocked out, the Cowboys, I would be okay.
Ooh, that hurts, Joe.
But however,
You guys.
However, John, I wish the Eagles was in. I'd be happy because the Eagles represent Philadelphia, so I would have been happy the Eagles would have made it. But it sounds like football. I just sit back and enjoy it, I guess, because the only connection you have is Andy Reid because he coached the Chiefs. But I guess, whatever. But I watch the games, though. But anyway, Dr. Molly and John, Dr. Molly, you keep it real. That's what I love about you and John. Y'all got good chemistry together. Y'all keep it real because, when I went to the hospital in South Jersey, I met a lot of the residents and fellows and medical students, and they are. You'd be surprised whether it was pediatrician, internal medicine doctor. They open to what you and John talk about, holistic ways, but they told us that you have to be very careful. They said because we train, everything that we get trained in medical school is to go the way of the pharmaceutical. And a lot of them, they was open-minded, and they said, Joe, I wish I could be more, do it more on the holistic side, because I agree with you. I'm not into all this over-the-counter and just giving people prescribing pharmaceutical. They said, but because of the way we train, but they said, we hope once we get our doctor's license, we can think more outside the box. And I appreciated that because I had, made friends with medical students of different races, black, white, Latino, Asian, you name it. And it was all open-minded. It made me feel so male, female. It made me feel so good that these young, up-and-coming doctors were so open to holistic ways. And that's like my own personal journey. And let me say hello to Frank, too, from the Northeast. And I'm open because
you're going to be a lucky man in a few minutes. Go ahead.
Thanks, Dr. Molly. Because my doctor, she's an MD, but guess what? And she put me on, like you said, Dr. Molly and John, she put me on hypertension medicine. But guess what she did? But guess what she did, though? As our condition improved, she said, Joe, you continue to follow your diet and everything. I'm going to slowly weed you off this medicine and put you on herbal. And that's what she did. And so for the last year, Dr. Molly and John, I've been taking herbal medication and following my diet, and my blood pressure is good now.
And
John,
that's
good.
Hey, Joe, that's why we love hearing from you, because you're a good case for what to do right. God bless you. God bless
thank you, Dr. Molly.
Thank you, Joe. Thanks for the call.
Thank you, sir.
Appreciate it. 855-839-1210 is our number here in the studio. Let's talk to Ann in South Philadelphia. Ann, good morning. You're on Health Watch with Dr. Molly.
Hi, Ann.
Good morning, Dr. Molly. Good morning, John. Dr. Molly, I just want to run something by you.
Sure.
I want to know if you're familiar with I have a little grandson. He's 2. And about a year ago, he had a very, very severe reaction to peanut butter.
Yes.
So he has a severe case of peanut allergies. So my daughter and son-in-law, about 6 months ago, started him with a peanut immune therapy.
Okay.
Which they go every other week, and they gradually increase. They give him 2 syringes of it's like a juice mixed with so much liquid peanuts.
Right.
Now he supposedly he does this for a year, and as the dosage increased, and then they told him that as he gets older, he would have to have 1 peanut and 1 cashew every day for the rest of his life to build up his immune system. Are you familiar with any of this?
Yeah, I'm familiar with the fact that they do. Listen, this is done. It's so funny that you're calling because I'm involved with a lot of allergy folks, and this is a new bona fide type way that they help these kids get through these peanut allergies. But I got to tell you something, Ann. And this is just me looking at life as an old grandmom herself, right? I'm 75. You know what? I would keep my kid away from peanuts even after this is all done. You know, I'm talking about heavy-duty peanuts, period. You know, just this week there was a case of a young woman who passed away getting a cookie from a convention, a conventional thing. And I was wondering the same thing that you're just talking about. You wonder if she didn't have the traditional treatment for the allergy. But I look, you have a peanut, and you know how this peanut allergy started. It started because we in this country love to use products that, you know, may not be the best, right, for ourselves. Right. That include these peanuts, you know. But I got to tell you, I'd still be careful. I know what they say, and you know, and I don't think you're being. I don't know how you feel, but I would be careful. That's your grandson, hon. You know, I wouldn't have peanuts in my house. I can tell you that.
Oh, no,
I don't care.
No. Like I said, he's only 2, but you know, the whole after this is all said and done, it's not that it's going to cure him. No, it's going to build his immune system.
That's That's the hope. But again, I'm saying even with that. I would be very careful because, you know, the ultimate physician, I believe, is God. So if he's giving him a little bit of a problem, I don't even want him to have a mild problem. Do you know what I mean? Let's err on the side of caution. That's all. But yes, I've read about this and saw it, and it's a big deal right now, particularly for, you know, avant-garde pediatricians. So obviously the kids are doing well by the baby. God bless you.
Thanks a lot for the call, and good luck with that.
Good luck with that. God bless.
Certainly, when your grandson is 2.
Yeah, you got it. You know, we can't be dumb either. You know, you got to use some common sense.
Yeah. Just want to mention. Yeah. Later on in the show, Dr. Molly is going to give you information about joining the Alliance of Natural Health. And we want you to stay tuned for that because it is important. And there's a reason why Dr. Molly wants us to do this. So we'll give you that later on in the show. Sure, John. You're always advocating for natural substances, and here's another situation. Sure. We are, I think we're shortly coming up on a break, but we're going to talk about some cancer protocols. And using natural substances in addition to, obviously, whichever way the patient wants to go. So, you know, in our clinic, John, we have several types of cancer represented. I hate to say it that way, but it's true. Represented in the clinic population. And interestingly enough, I have patients who want to do the full gamut of chemo and radiation, of course, surgery, if they have solid tumors. But lately, and it's one of the things I'm going to talk about, I've been seeing more and more of the blood dyscrasias as well. And sometimes I wonder if that's not an indication of more of the environmental. For example, I know when I started out about, 20 years ago, I saw a lot of people. It was just about the time when people were talking about the Roundup and some of the soft tumors coming out. And we saw an increase in that. And hopefully we've adjusted the Roundup that we're not using it as much, and you see a little drop. But then we see other dyscrasias coming around. And many times I really run panels that show this patient may have heavy metals, this kind of thing, which, you know, we can chelate out as well as support them through their cancer protocol. You're going to also talk, coming up in the next segment, soft tumors.
And that's it. That's what I'm talking about. Right.
And also a rare type of blood disorder.
Yeah, I want to talk about a case of a gentleman who called the office. I don't think he's a listener, but he called the office and he has a very unusual, or let's say a cancer that isn't normally seen. It's CMML, and we will talk a little bit about that and what I'm thinking I can do for this gentleman, and some of the reasons why I want us all to join the Association for Natural Health.
There we go again.
The lobbying group for people like me.
Yeah,
Thank you.
That's right.
Thank you.
It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We are at the halfway point of the show. As I always say, time flies when you're having fun. But you got plenty of time to call in. 855-839-1210 is the number. 855-839-1210. Dr. Molly is here and ready to talk to you at 855-839-1210. We are both, Dr. Molly and I are both coming back with more of today's edition of Health Watch after these words.
This program is paid for by Innovative Medical Associates.
We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates. And the number, 856-489-0505. Again, 856-489-0505. When you call, you want to make that appointment to sit down with Dr. Molly and you go over your situation in its entirety, and you'll learn a lot, and you'll really find out whether Dr. Molly can help you or not. And most likely she can. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. It's Health Watch every Sunday, 8 till 9 here at Talk Radio 1210, WPHT. We'll talk to, right now, one of our favorite callers, Frank in the Northeast. Frank, good morning.
Hey, Frank, how are you?
Good morning, guys.
Hey.
Dr. Molly called it. I heard Mayor Joe. Dr. Molly, are you sitting next to John?
Yeah, across from him, right across from him.
Well, I'm glad because I don't want him to have a heart attack because Mayor Joe and me are both Cowboys fans.
Oh.
I'm also a Miami
my
Dolphins fan,
God.
too.
Oh, that really
You're
hurts.
hurting, John.
That
Now,
really
you know
hurts.
what? Hey, you know what, Frank? Now I got to tune up his IV on Tuesday.
Yeah,
you know that,
yeah.
right? Oh, my God. Okay.
I mean, I support the Eagles, but I mean, I was born in '65. A little kid, like, Cowboys and Indians, and
Sure.
the TV show Flipper. But ever since then, I've always been a Cowboys and Dolphins fan.
God bless you. God bless you, Jim.
Oh,
And I'm glad you're doing well, and you can watch the game today, my friend.
But Dr. Molly, did you ever hear of a pharmacist named pharmacist Ben Fuchs? He's on the George Norrie program every 6 weeks. It comes on around 1 in the morning.
I'm not sure I heard of him, but I'm sure he's a member. He's a compounding pharmacist?
I'm not sure. I know he's been doing skincare, his own line of skincare. He's out in the Colorado area, I think. I'm not sure.
Well, you know why I asked that? Because, I use the guys who are members of the group of compounding pharmacists because I want to make sure my powders are, really up to snuff. I want grade A powder, and, I'm fussy about that. So I love all
for skincare.
Well, skincare, I'm sure they're using excellent products. I have no problem with that, and he probably is, but I am not familiar with him per se. Okay.
Well, he said something. This is the question I have for you.
Sure.
He said something. He was on Wednesday night and a Thursday morning.
Yeah.
I never thought about it. I'm asking, is it true? He said, any medication you take, no matter what it is, your body will try to get rid of it because it's not natural. It's a chemical. And if you're on anything long term, you should be doing everything possible to get off it because it's not good to be on medications long term. Does our body naturally reject any kind of medication?
Here's the thing, John. Here's the thing, Frank. The way I speak to John all the time on the show is I tell people you can't throw away your medications. Do I like the fact that people are 20 years on one drug? And I have had that happen. After a while, you got to believe that some of the efficacy of the drug has gone down, and hence the problems. Now, as far as the body getting rid of the particular drug, one of the things that I'm very cognizant of, I use a lot of glutathione, alpha lipoic acid, acid in my clinic, and this is all done through hydration to make sure that the liver can continue to process the particular pharmaceutical as well as the natural constituents I need in order to make sure the liver stays clean. But I think to say a blanket statement that you should get off of all your drugs, I don't think you should be on any drug long term, but we can't always say that because look at the diabetic medications, although there are a whole new line coming out. So, when you need a medication, you need the medication. I tell you this, I would do everything I can to maintain my liver health, to maintain my immune system around the particular drug, and I would augment with natural products. So I guess that's the way I can answer that, Frank. And
okay, Dr. Mal, just so you know, I'm not doing good. I'm doing really bad. Everything's a lot worse. But also, just the way it is, I'm still fighting. I'm doing something different right now. But also, one more thing, please. Mayor Joe, in 3 years or so, when you campaign for mayor of Philadelphia, not just G-Town, I'll be at Bridge and Pratt with the commuters, getting them coming and going from work. I'll make sure we get you in there, Mayor Joe.
All right. You got it. God bless you.
Thanks,
God bless
thanks
you.
for the call, Frank. 855-839-1210. That's our number here in the studio. Always brings a little levity to the show.
Yes, he does.
We're going to talk about cancer protocols.
Right. So, John, I just want to go over some of the things we use in cancer protocols. We can use curcumin. You always talk about vitamin C and the anti-inflammatory properties. And again, vitamin C has a beautiful God-given thing to turn from pro-oxidant to antioxidant, so you can use it with the chemos, etc. It depends on what cofactors you use. We look at curcumin. We look at things from green tea extract. There's a lot of data supporting that for certain cancer types. I look at things like all certain B vitamins that are extracted from a natural substance. You know what's interesting, John? I have 185 citations that you can go on PubMed showing that certain Bs that are extracted from certain substances, and one of them is allegedly not available in the United States, but when you look at some other areas of the world, like in Germany, they're using it extensively, and it's having great effect on solid tumors and also on some soft tumors. Also, look at a drug that was developed from a natural source for malaria. And this is interesting because we heard all about certain things during COVID, if you remember, that they did a big no, it doesn't work, nothing works. But interestingly enough, a lot of people did very well on a particular drug. And this was out there. People were asking my doctor to prescribe it, and the docs in our office. And if the patient was doing some alternative treatments to help clean the liver out, etc., he would prescribe it. They would prescribe it. So the bottom line is you want to look at what I use on a molecular level. Why do I use natural substances? Because I believe God's ingredients, there's an ingredient in these natural substances that actually approach the cancer support in a molecular way. They work on certain pathways. It is extremely important to look at the database out there, meaning someone like by the way, you pay for that. A scientist like myself or scientists in research pay for these databases. But when you look at the conventional treatments that are coming around, and that's something I want to talk about later, you will see that many of these constituents, like for example, alpha lipoic acid that's naturally occurring in certain fruits and vegetables, actually has a pathway that works for autoimmune issues, cancers, and cardiovascular conditions. So that is why I love the natural substances. It's not because I'm, in la-la land, but I'm looking actually at the science behind these particular supplements. And that's what excites me, John.
I was thinking about this. Can people go to the health food store while they're in your chair?
Sure.
Can they enhance what you're doing?
Sure.
What would they get?
But I don't know. And that's the key. The key is why not why not lean on somebody like my nurses who have a really good understanding? In particular, Barbara, actually, she came in this week. I had people from out of town. She sat with one family this week for over an hour going through their particular group of products that they brought from Indiana, and every single one of them was really not so good. Okay, they left.
That would be Barbara, yeah.
Right, and I will tell you something, and she wasn't wrong. She had the data to support it and show why it was what was mixed in with it. So the bottom line is we point people in the right direction, and you can buy what we point you to in the health food store. I'm not out to sell you, $5,000 worth of oral product because, again, I'm looking at the constituent in it, and it has to be at a therapeutic level.
So don't just buy something without talking to you.
And the other, I get 1 million calls a week wanting me to tell them what to go on. Frankly, that's not, what I want to do per se. I mean, I'll give you a little bit of advice, but my goodness, to really put together a protocol for someone takes time and effort on our part.
Yeah, and your protocols are really
spot on. They are spot on.
Yeah. We are coming up on another break here, but we still have time to take your calls at 855-839-1210. That's 855-839-1210. The program is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPH.D. Like I said, we have plenty more to talk about. And if you want to call in with a medical challenge or a question for Dr. Molly, 855-839-1210. Dr. Molly and I return with more of today's Health Watch after these words. Back here on Health Watch, operators standing by, and they'll be there well after we leave you at 9 o'clock. 856-489-0505. Look, they may want to watch football this afternoon, but their job is to take your calls. 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. A lot of good information on that as well. It is Health Watch, the live version, right here every Sunday, 8 till 9. Talk Radio 1210 WPHT. 855-839-1210 is the number. We still have time for a couple more calls before we leave you at 9 o'clock. And Dr. Molly, you wanted to say something to Frank?
Oh, yeah. Hey, Frank, you know what? You ought to come back into the office because I don't like the idea that you said you're not feeling so well, and I haven't seen you in a while. Why don't you make an appointment and come in and see us, will you? You know you're beloved at the clinic. Thank you.
So we want you to get well, Frank.
Right.
Okay.
Right.
You want to give us an update on some of the cancer patients?
Oh, yeah. Some of my cancer patients, very good. I have a young man, as you know, who started with me not that long ago, who has a very unique challenge because he has liver and pancreatic cancer. And he is doing very well. He's holding his own. But I want to talk a little bit about the process of how we came up with his particular recipe. It's not so simple because it entailed both my healthcare providers and myself sitting down, reviewing his chart at great length, which I do for all of our cancer patients, reviewing all the medication. By the way, his medication options were, meaning his chemo options, were very limited. And he's a very smart guy. He was in good health up until this particular challenge, and it came on him quite suddenly. And he's young. He's 42 years old, young wife and kids. So I want you to know that it took a little time. He's now following a particular protocol, and I told them to look up some of what I'm doing. It's a use of vitamin C with a particular type of K vitamin, along with several homeopathics that we use that are very uniquely made for our clinic. So he's doing well, John. He's only on number 5 treatment, and he's holding his own. We have to continue to watch his blood count, his red blood cell count. That's not unusual because we're worried that he goes into a more anemic type of state, which would be detrimental for him. So again, your favorite ingredient is used in this, but with a caveat, using several other things.
And it's your unique protocol.
It is is a unique protocol. That's one of them.
Okay. Breast cancer patient?
Breast cancer patient. She's wonderful. Okay. She's a chiropractor. And so this patient has a propensity for alternative treatments. When she came in to see me the first time, I said, I know you're getting the surgery. Well, yeah, she's at the end of our conversation, she says, yes, I'm going to get the surgery, Dr. Molly. I said, fine. I understand you do not want to do radiation or chemo. So why don't we take this one bite of the apple at a time? You come in 3 times a week for a hydration treatment that will include the anti-inflammatories, certain particular things, including the green tea extract, etc., beta-glucan, quercetin, which is extracted from onions for her in particular. Anyway, she had her scans. She's doing well. The tumors there's no other tumors. She's holding her own, and she is not going into the anemias that they expected.
Boy, I'll tell you, you've got some cases.
So then I have one potential case. I don't know. The gentleman said he's not a listener, but he called the office, and he has something called CMML that comes. It's a chronic myelogenous myeloid leukemia. And what it is, it comes in 2 forms, 1 and 2. The life expectancy, there's not many products out there in terms of the chemotherapeutics. There's one oral that he is taking at home. That's a good one to maintain it. And I would tell you that he's coming in, and I did some research on this in addition to what I knew would work for certain blood dyscrasias. And I found out that dandelion root has a particular propensity to work on a particular pathway for him that actually works by working on his phosphatidylserine, which can be a tumor killer, so to speak. It's how it's used. So in a case like his, we have to use some targeted therapies that are very unique to him.
You know, I've been listening to all the things that you've been saying, and I just wanted to mention that if people want to go out and look for the health food store that has what you've been talking about, that's not the best way to go about it. Okay?
No, you don't.
Talk about how you should go about it.
Well, you should go about it by talking to an integrative physician or an integrative counselor who's a scientist who understands the mechanism of these particular products and the particular pathways, the molecular pathways that work for them, and that we don't use things that possibly overlap in a dose that is either too large or too small, because overlapping can be just as bad. You know, I subscribe to one theory and one theory only, Goldilocks,
that's right.
Like the 3 bears, just right.
That's right.
And that's something that I think people have to realize. Again, things just because they're natural doesn't mean they're going to be totally good for you.
All right. We want everybody to pay attention now.
Listen,
Dr.
folks,
Dr. Molly is going to tell you.
I am going to tell you something that is
the Alliance of Natural Health. Very
important, and I'm putting it on my website for a link to them because they are the only group, that is the lobbying group for medical hydration and medical folks who use natural products, and they have really put the government is really clamping down, and I'm going to tell you why. There is a group right now of scientists who are working for Big Pharma, and they're intelligent. They're people just like me. In fact, they're smarter than I am, because what they're doing is they're looking at bioactive natural compounds for cancer treatment as related to the natural substances and making them drugs. So, folks, I want you to please remember that we depend on getting and securing the powders for our natural products, and it's something that we should all be aware of, whether we take them orally or through hydration or tincture. We need to make sure that the government knows we don't necessarily want them in our medical care.
Big Pharma is trying to make this natural
They're
substances.
They're doing it,
drugs.
Not just trying.
Oh.
They're doing it with a lot of the immunotherapies. And we need to realize they changed the structure, but they're looking at the structure of the natural ingredient, and they're trying to mimic the structure in a way to make a drug. And I'm telling you, that has a lot to do with all the new drugs that are coming out, the biologics, all of these things. And again, I'm not against any of this. Not against it philosophically or scientifically, but what I'm saying is if you want to go for a natural approach, you're things could get limited in the next 10 years. And it's happening now, folks. We need to be on top of our legislators and ask them to please stay out of our medical choices.
So the Alliance for Natural Health
is a lobbying group for natural practitioners, natural MDs, and people like myself.
Go to Dr. Molly's website.
As of next week, it'll be on there.
InnovativeMedicalAssociates.com, and you'll see that. That's going to put the wraps on another edition of Health Watch. Don't forget, we're here every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. If you want to talk to Dr. Molly in their office, 856-489-0505, 856-489-0505. The operators will be there well after we leave you at 9 o'clock, and they're not just watching football. They're taking your calls. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel. And, of course, there's Joanne, then Delightful D, Fabulous Fran, who makes a great cup of coffee, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. Stay tuned for The Heart of Your Money with Joe Yakovich right here on Talk Radio 1210 WPHT. Take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.